About 1 million children were dying every year from this disease. And nothing truly changed the course of malaria until the turn of this century. Many of you were involved in this. In 2005, with critical support from Congress, the US President's Malaria Initiative was launched to end malaria. PMI, alongside the work of others like the Global Fund, have invested billions of dollars to partner with national governments and local health workers to purchase hundreds of millions of mosquito-killing nets and sprays, life-saving malaria tests and medicines, to support health workers who are heroic both in clinics and in communities. And with sustained global funding, many more children and their families with malaria now get tested and treated and have nets cast over their beds at night, just like I had when I was a child, to prevent them from contracting it. Between 2000 and 2019, national governments, working with local health workers, and because of sustained funding, saved an estimated 7.5 million lives, and an estimated 1.5 billion infections of malaria were prevented. So we are at a pivotal turning point now in this story. Today, 40 countries are free of malaria. And we know there's hope when we look at the countries profiled in this report: El Salvador, Ethiopia, India, Senegal, the greater Mekong subregion, and Uganda are amongst those that are making impressive progress against this disease. Each location profiled in this report gives us a blueprint for success, demonstrating how innovations like bed nets, rapid diagnostic tests, and medications used strategically and made accessible to the most vulnerable communities can drive extraordinary progress. Just as crucially, the countries profiled in this report developed strong data and surveillance systems. They trained community health workers to diagnose and treat malaria. And when necessary, they forged cross-border partnerships to contain the disease. For example, our partners in Thailand have cut malaria cases by using such strategies by 90%. And a key part of that success was training 1 million community health workers. And El Salvador used the help of thousands of community health workers and strong surveillance systems and data systems to rid itself of the disease altogether. I know we're all excited earlier this month to hear the historic recommendation of the world's first malaria vaccine by the World Health Organization. I can say on behalf of my colleagues in the United States government and as an American, we've been particularly proud because some of the early research for this vaccine was funded by American taxpayer dollars and by the United States. This vaccine can help reduce the risk of deadly severe malaria by 30% in young children in sub-Saharan Africa. And I can say that if such a vaccine had been around back when I was a child, my mother would have been relieved by the additional layer of protection it could provide. But let's be clear, while the new malaria vaccine is historic, it's not a silver bullet. Over the last 2 decades, we all have learned that innovations like rapid tests, novel medicines, new insecticides to kill malaria-carrying mosquitoes, they all raised hopes. We know that. We know that we've all purchased hundreds of millions of these life-saving products. And yet we've learned medical breakthroughs are not enough. On their own, they can't defeat malaria. And that's borne out by the evidence. Millions of people, largely in rural and poor communities, still remain out of reach of the innovations, the tests, the medicines, the nets that we have already had as breakthroughs. We know the consequences of that. Malaria still causes more than 200 million cases and 400,000 deaths every single year worldwide. Another child will have died in the last 2 minutes I take to finish these remarks from this disease that we know how to prevent and treat. That's unacceptable. So while we welcome the recommendation of this new malaria vaccine, and we know we need hundreds of millions of doses, not tens of millions of doses, and we know we must fight to reduce any inequity in access to this newest tool, we have to remember this newest tool works best when it's scaled alongside the other tools and delivered to people. And that's why the President's Malaria Initiative was proud to announce earlier this month to partner with the global groups as well as national governments and local health workers, we launched a new strategy to help save 4 million more lives and prevent 1 billion more infections by 2025 to contribute to those global goals. And we plan to do that by focusing on partnering with countries to hire and train community health workers to bring tests, medicines, and nets to the millions of children and families affected by malaria in rural and poor communities who still remain out of reach of these life-saving breakthroughs. And it is those systems that ultimately, along with immunization systems, that the vaccine will ultimately be delivered through. Let me end, Dylan, by saying, we know malaria has changed history, and we know the fight against it is changing the world. But we have to remember that the historic progress we've made together is in danger. Truly, global funding for malaria has plateaued, and the unmet global malaria funding threatens to reverse gains we've already seen prior to COVID-19. That deaths dropped by only about 2% every year, much slower than they had in the first 15 years between 2000 and 2015 of this century. Now we have COVID-19, which has had devastating impacts on health workers, on health systems, that risk setting progress back on malaria further by years. And we have the chronic threat to health security. Malaria is the oldest global health security threat, perhaps. And we know that there's new evidence of resistance to insecticides and medicines in sub-Saharan Africa, where the disease still claims most of the lives it takes every year. That malaria is a climate-sensitive disease. Unpredictable effects of climate change is going to potentially worsen and spread more grounds for malaria-carrying mosquitoes to attack us. And then we have the issue of chronic conflict. Many of the countries where malaria progress has been set back or slower are in fact impacted by war or conflict. And these all pose major threats. So we need to make no mistake that a reversal in this progress that we've made will have dire consequences. It will result in hundreds of thousands of additional deaths. It will result in the risk of outbreaks and drug resistance spreading. It will undermine economies and increase poverty, and ultimately it will make us all less safe. So again, I want to thank you, Dylan, for having me on, and thank those who produced this report, because it makes clear that it is not easy to sustain progress against malaria, but it also makes clear that we know what we need to do to be successful. We've got the tools, we've got the know-how to save millions of lives. And I want to emphasize that this wouldn't just be the right thing to do, to save millions of lives. That should be reason enough, but it turns out it'd be the smart thing to do. Ending malaria would pay for itself many times over, creating $2 trillion in savings. So we've got to focus on scaling up what works, reaching those most at risk, innovating and being ready to scale new interventions, but also to create the political will to end this pandemic once and for all. I'm going to turn it back to you, Dylan. I look forward to the discussion today with Ambassador Okara, Dr. Gerardo Castellanos, and Dr. Prayuth Sudantip. I want to thank you again to all of you for sharing your perspectives today. I'll turn it back to you, Dylan, now. Thank you.
Thank you so much, Dr. Punjabi. Thank you for your thoughts and putting this vaccine news in perspective, and for everything you and PMI do. I'd just like to note that we have a Q&A box open. If you're listening on Zoom in the webinar, there should be a Q&A button on the sort of lower panel next to sort of chat and participants. Please put in any questions you might have for our panelists, and we'll go through that and be able to ask a little later in the program. So for now, before we launch into our discussion, I'd like to go through and introduce our panelists. Unfortunately, Joy Fumafi had a last-minute conflict, won't be able to join us. She'll be missed, but we're honored to have Ambassador Anthony Okara, who's Senior Ambassador on Malaria for the African Leaders Malaria Alliance, who is joining us in her stead. We also have Dr. Luis Gerardo Castellanos, who is the Unit Chief for Neglected Tropical and Vector-Borne Diseases at the Pan American Health Organization. We have Dr. Prayuth Sudantip, who's in the Division of Vector-Borne Diseases at the Thailand Ministry of Public Health. And we have Olivia Ngu, who is the Executive Director of Impact Santé Afrique and Global Coordinator of Civil Society for Malaria Elimination. So thank you all so much for joining us here today and being part of this discussion. Why don't we start out? We've seen countries have incredible success in engaging community health workers and volunteers in the fight against malaria, including in El Salvador, which has been certified as malaria-free earlier this year, which is a huge milestone in this effort. I want to ask first Luis Castellanos, and then we can open up to the rest of the panel. Can you talk a bit about why community health workers are playing such a vital role and have often been instrumental in turning the tide against malaria?
Yeah, sure, and thank you, Dylan, for having me here this morning. My most sincere regards for all of the panelists and for all of you who have worked very hard to organize this webinar. I think first to mention the great success of El Salvador, not only because they reached elimination of malaria, but keeping in mind that this is small country is surrounded by borders of other countries that still fight malaria. It's an outstanding accomplishment. People tend to think that, and we as PAHO encourage people to understand that malaria needs to be eliminated as a whole. If one country remains with malaria pockets, and then the battle is still ongoing. So seeing countries like El Salvador, who fought for 70 plus years to eliminate malaria, and have demonstrated with evidence that despite of the fact that they have countries struggling malaria in all of their borders, 3 countries, they do achieve elimination substantially before the other countries did. I think that's a remarkable. For those who know the Central American area, you should know that borders are very open. So transit of people in between and among these countries, it just flows. So you wonder how this country manages to do that. And part of the response to that is precisely the question you asked me. What's the role of community volunteers? Community volunteers or community collaborators or volunteer collaborators, whatever you want to call them, to me are the backbone of public health in Latin America. They're always present and they're always at the front line of any achievement in public health. You can go back in history and find out that community health workers are always part of the great successes. From the elimination of malaria in the 50s in the first countries in Latin America to very recently the achievement of elimination of onchocerciasis, trachoma in Mexico, you name it. Community health workers are always part of that effort. Why is that? There's numbers of reasons, but let me mention a few of those. First is, Dylan, no one would be more interested that a person living in a risk area than anybody else to resolve that problem. So for community health workers, it's a matter of their own health. They are part of these communities under the risk of suffering these diseases. They have probably seen the impact of these diseases over the years in their own family lives, maybe in their own personal lives. So for them to be part of the effort to control and eliminate these diseases, it's a natural. So you can tell the level of commitment of these workers. In El Salvador, they started in the 50s with less than 100 community workers. In 5 years, there were hundreds, and by the year 2018 or so, there were more than 3,000. They don't get paid. They just work because they want to get the problem resolved. And I think that's the most important thing. You don't have to convince them to work. People wonder, how is that these poor people devote themselves for lives sometimes? They're by generation, passing this commitment to their kids to continue doing what they do for free, it's because they've seen the impact and they want to live in a community that it no longer has the risk of those diseases. Number two is because I think community health workers understand the environment in which they live. A community, we workers in public health, trained workers, we go into these communities to stay there for a day, for a week, and then we leave. But we don't understand in detail the sensitivities of the cultural environment, the socioeconomic dynamics, and the importance of relating to that. They do understand that. They understand what's important, the sensitivities in their culture, so they can approach the community with confidence. And that's another highlight of them. I mean, they don't only get resolved to find people with fever or with the suspicious cases of malaria. They try to help their communities in many ways. So community look at them in a highlight as a member of their own community who is fully committed and devoted to help because they are part of their own community. So there's trust embedded in all this process, and that helps very much. And I think the third that I can come easily to mention is the importance that these community health workers, these volunteers, are made part of the system. In El Salvador, for instance, there were more than one structured activity that made community health workers feel they did belong to the system. They were, for instance, trained, they were identified with uniforms and badges as part of the Ministry of Health. They received supervision, they got their own equipment, they got all of the materials to work with in a community level. So that made these community health workers feel important, respected. They were present, they were acknowledged, and we have over the years made efforts so governments do recognize in public, they acknowledge really the great value, the contribution that these workers have done. And more importantly, many of them felt that once the disease was eliminated, their work was done. And what we've done over time is that we move them in countries like Paraguay, in Argentina, to be retrained and continue their work and their contribution to eliminate other diseases. So now they've seen that their value remains in the community and in the country, so they move forward. And I think that's probably the short, long answer of why community health workers are so important in El Salvador and in many more countries of Latin America. Back to you, Dylan.
Thank you so much, Dr. Castellanos. I want to open it up for the rest of the panel if other panelists have experiences with working with community health workers and the role of community health workers in their country context. So perhaps Dr. Sudatheep, do you have some experiences from the Thai context?
So thank you for inviting me to be the panelist, actually. So in Thailand, we have volunteer throughout the countries, actually, but for specific to malaria, we will focus on in very endemic area near borders. So in each village, we have village malaria volunteer who we provide them RDT and medicine to test and treat their communities, and also follow-ups to monitor the compliance to medicines, and also help our health personnel to do net distribution, REDIP nets or IRS. So I would say that the malaria volunteer is very effective organizations to reduce malaria along the border in Thailand. Yeah.
Wonderful, thank you so much. I want to open the discussion up. We've been talking about community health workers, but obviously the whole community, not just sort of specialized health workers, are so important in this effort. So Olivia and Gu, what role do communities play in the fight against malaria in their countries? How do we leverage community engagement, not just community health workers, but the whole of the community to make real progress toward ending malaria?
Yes, thank you very much. Thank you to the organizer of the webinar, and congratulations to PMI with the new strategy, putting a high emphasis of engagement of communities and also local actors in malaria programs. So thank you so much for that. So regarding community engagement in malaria, we spoke about community health workers, for example, but when we look at malaria tests, the malaria diagnostic and treatment at the community level, and especially in areas that are difficult to reach by the health system, those who actually produce the data we have on testing and treatment are mostly community health workers in those areas where people don't have access to health centers. So they are incredibly important to test and to treat malaria, simple cases, and even to bring the data back to the health system. So those are a huge component of our malaria data today. In some countries, even 50% of the data comes from those community health workers. But besides community health workers, community engagement in malaria program is critical, because when we have, we can have the best tool in the world, but if the population and the community are not using those tools effectively, then we will not have the impact on the use of those tools. For example, we know that we spend $1 billion on mosquito net. So it's very key to ensure that communities use the net, uptake the net. We know that there's a new malaria vaccine coming up. So it's going to be very key to engage communities so that mothers can and fathers can and caregivers can bring their baby to the health center to get vaccinated. Unless we do that, we will have tools that will not be used, and that will be a waste of money and a waste of funding that we don't even have enough at the moment. So, but it's important for us to go one step behind just community engagement around providing malaria services. Moving beyond just malaria services, providing malaria services is really key to engage communities and including civil society in the design, the implementation, and the monitoring and evaluation of malaria program, making sure that we have also community-led intervention, and I insist on the word community-led intervention, not intervention that are led by outsiders, but really have the community to lead the interventions at the community level, and also to monitor the program to also be implicated in malaria surveillance. We know we have resistance issues in some countries that we need to look at. We know that there's very important data that needs to be collected to make sure that our program, our molecule, our intervention are still very impactful in many areas. So communities-led monitoring and program and surveillance is very, very important. And just lastly, around accountability, because we know that we need voices of people affected by malaria to remind their leader, themselves, and everyone to be accountable to the success of the malaria program, be accountable to the stock and the tools that we buy, be accountable to the funding that we need to raise, and really increase the level of accountability in the malaria space, just similarly to the HIV or the TB program. We also need to increase a level of accountability, because we know that our country have national strategic plans that are well written, that are costed, but usually what we're seeing being funded is Global Fund interventions, PMI interventions, but no one really talks about the gap, what is not funded in the strategic plan needs to be funded. Who is accountable for that? How, which role our leaders are taking to make sure that we can fund all the strategic plans fully to be able to achieve our mission to end malaria. So political engagement and accountability is really also critical. And this is the key role that community civil society play and will continue to play. And we're very happy to see that is a priority for the global malaria community, and the civil society and people affected by malaria now have a stronger voice, and we'll make sure that we keep everyone accountable, including ourselves, to make sure that our resources increase access to quality malaria services and quality tools for all communities. And I really insist on the word quality, that we have the best tool for everyone in an equitable manner. Thank you.
Thank you so much, Director Ngu, and thank you for some of that context. This new report is really notable in highlighting a number of successes across different tools in the fight against malaria. It discusses bed nets, rapid testing, medications, insecticides, all of these and how they work together to drive down cases and deaths. So I wanted to open it up to the panel to talk about why these interventions have been successful in different contexts, and how how we can tailor combinations of them to distinct contexts around the world. Perhaps Ambassador Okara, we can start with you and then open it up to other members of the panel. Perhaps Dr. Castellanos, it seems Ambassador Okara isn't available right now, but if you have some thoughts on how to combine these approaches.
Well, sure, Dylan. Let's hope that Ambassador can contact back. But let me tell you what we do in the region of the Americas, where thanks to the great effort of the public health ministers throughout the countries, we have managed to downsize the total malaria burden to less than 1 million. We're navigating the 600,000 figure this year. And of course, the pandemic has had an impact on that because of lockdowns and restriction of movement of people. So very few positive, results of this terrible pandemic. But here, what we do is we do a lot of effort for the analysis of the epidemiology of the disease in our region, and based on the details and the context in which malaria occurs, we select the intervention or the combination of tools more appropriate for that specific context. One of the rules we have is if we do insecticides, we not necessarily use bed nets, and if we use bed nets, we try not to use them both at the same time or in the same location. We also feel very fortunate because of the conditions in the Americas allows us to access the great majority of population given the urbanization that has progressed in our region. So going back to community health workers, they're not just selected randomly. They're very carefully selected based on location to make sure that all of those communities that are hard to reach have the presence of voluntary community health workers, just to make sure that access to diagnosis and treatment are available for these communities. So the combination of having a disease that is easily can be made diagnosis and can be treated with existing drugs, with existing tools. It's a highlight that does not exist for many other diseases, and it's a huge challenge. Take as an instance arboviruses. We don't have a drug for controlling or curing dengue, and that's a huge comparison of contrast with what we have with malaria. We can detect, diagnose, and treat malaria if we use the proper tools, and that's something that Olivia said properly, and I highlighted in the chat. I don't think it's enough to have the tools. It is equally important to use those tools properly, which demands great training, organization, coordination to make sure these tools are not only available, but used properly by the right personnel with the right training.
Wonderful. Thank you so much. Dr. Sudadeep, do you have any thoughts on how to combine these approaches most effectively?
Yeah, the situation in Mekong sub-regions may be different from other world, actually. We have specific unique of behavior that easily for the villagers to get infections. So most malaria cases in Mekong sub-regions concentrate among adult males who work in or near forested area. So both insecticide treated nets and hammock nets have been used as the effective tool to prevent malaria in Mekong sub-region currently. And since in Mekong sub-regions have very high drug resistance, so strict drug regimens for radical kill have helped Thailand to address emergence of drug resistance, which is we aim to eliminate falciparum by 2023. And currently we using, we call integrated drug efficacy surveillance programs, which is we follow up all malaria cases until they get cured. So the results of follow-ups, we will use to reviews to ensure that people get cured and also monitor drug resistance in our countries. That's the tool that we use in Thailand and Mekong sub-regions. Yeah.
Wonderful. Thank you so much, Dr. Sudadeep. Ambassador Okara, it seems we have you back. I wanted to ask you a bit about the intersection between malaria and COVID-19. As many people on this call probably know, COVID-19 has really disrupted efforts to fight diseases like TB and HIV/AIDS, but malaria has fared a bit better. Can you talk about why malaria programs have been more resilient in the face of COVID than some other public health programs?
Yeah, thank you very much, Dylan. And sorry for that. There was a little network issue, but I'm back on.
No worries.
First of all, just to thank you very much for this opportunity to join you today. We are really happy. And again, apologies. Joy had initially indicated she would have come for this, but as you mentioned, there was a conflicting schedule, so she was unable to come. But we take this opportunity very seriously, and we're very happy to be here. And then also just to quickly mention, we really appreciate the report as well. It's well written. As at ALMA, what we do focus on is trying to get policies, documents that are chewable for the policymakers. And the way this is done is more or less along that line. So it's a useful material for us in the war against malaria. Now, as you've indicated, COVID-19 initially did derail the war on malaria, especially in Africa. However, there was a good response by the authorities, and we've managed the preventive services are 90% back on track, and the diagnosis and treatment is also getting back almost to the levels of pre-pandemic. And what are the factors? How is it that we were able to do this? We'd like to, first of all, indicate that we drew very important lessons from previous outbreaks. As you know, we suffered Ebola, which affected countries like Liberia, Sierra Leone, and Guinea. And the impact it had on access to services was so devastating. And we immediately got into a worry that the same might occur. If we don't attend to this, it will be possible that you have a situation where all the countries begin to deal with the COVID situation and completely neglect the basic. And this would immediately reverse all the gains made on malaria. And being an epidemic, our fear was, in fact, the WHO expressed that kind of concern, that the numbers may go back to double what they were existing at the time. So we were pretty worried. In this particular environment, we had strong leadership as part of the response from the President of Kenya, Uhuru Kenyatta, in his capacity as the chair of ALMA. ALMA is comprised of 47 heads of state and who have decided to prioritize the fight against malaria. And this was very useful for us. He actually got onto the phone and began contacting all the leaders to ensure that the campaign is back on track, that it was possible to continue with the campaign while attending to the fight against the pandemic. And the beauty is that actually they're aligned. I think somewhere in the report there's a mention that investing in malaria is also investing in the health system, and the benefits are clear. So this was very clear to us in this particular environment. We also had really excellent reinforcement by the partners, the Rollback Malaria, the UN program, and other partners like yourselves, who did reinforce that message that we needed to ensure we get back on track. The programs that you're supporting modified your plans very well, and the campaigns took place. So where we moved into door-to-door, for instance, which in itself was useful for lowering the pandemic danger, but at the same time, reaching out to the people that required help. Generally, when you look across the pandemic period, at 75% of the campaigns took place as planned, 75%, which is a pretty high number. And when malaria case management commodity stocks become low due to delivery, countries, their partners and donors helped to source supplies, split orders, and work to accelerate deliveries. Because our initial concern again was the delivery system being affected. Just like in the case of El Salvador, the community health workers ensured the case management continued to be very close to the community as possible. Being from the community, they were very active and they adjusted pretty well. So that was something that was very useful in the African environment. Best practices were shared amongst countries. What we found that was this willingness to share information, to engage with one another. There are different groups in Africa. We have the regional economic communities, and there's a lot of sharing of information and best practices and communication. So this was actually very useful in ensuring that we kept the malaria war on track. Now, we must, however, continue to work very hard. In as much as we're pretty excited by the way we kept on track, we must keep focusing. There remains a risk that we may not have adequate resources to keep this war. Right now, there's a distraction. So we need to ensure that all the partners have their hands on deck and we keep going. We do not go towards, there's in talk right now of pandemic preparedness and awareness. And we in as much as that is critical, the resources should not be diverted entirely in that effort without forgetting about malaria and other areas. So I think, Dylan, I'll hand it back to you. Those are the key things I'd like to share at this stage, and we can see how it goes from there. Thank you.
Thank you so much, Ambassador, and glad to have you. Dr. Sudhadeep, I think our next one's for you. I wanted to ask about some of the collaboration between the Global Fund and the President's Malaria Initiative. I know in the Greater Mekong subregion where you work, and also in places like Ethiopia, the Global Fund and PMI work together quite closely to provide financial and technical support for anti-malaria initiatives. Can you explain how the two organizations work together and why that kind of cooperation is so important in the fight against malaria?
Yes, in Thailand and also in Mekong regions, we have support from both Global Fund and PMI actually. So, but specific for malaria, for Thailand, divisions of vector-borne diseases work closely with Global Fund and PMI to harmonize approaches and also harmonize resources to meet the technical needs for our countries. So this approach is essential to maximize efficiencies of our pooling resource to allowing strength, and each partner can share our resource in the regions. For the most part, PMI provides support to National Malaria Program to generate evidence and identify effective interventions and tool and strategy. PMI also work with Global Fund to more rapidly scale up of this effective strategy and intervention throughout the countries. So we are work very closely in terms of financial and also technical support.
Wonderful, thank you so much. I wanted to open that up to the rest of the panel as well. Dr. Castellanos, do you have some experience with the collaboration between Global Fund and PMI and how that's worked in some contexts in your experience?
Well, first, let me acknowledge and thank them both, because in the region of the Americas, the substantial contribution, not only financially, which is very large, but technically speaking, we have reached a level of coordination and collaboration that has eased the work of everyone in our region. Nowadays, we have frequent technical discussions of coordination with best approaches at country level and at subnational level. We join efforts and coordinate distribution of assets and in investments to make sure the country is getting what they need without duplicating or even competing in terms of the needs that the country sometimes requires. And I think that has helped, and that has also enlightened countries to understand that as the better coordination arrives, all in the same boat, is much better than receiving all of these isolated efforts to help the country, reach a goal, not knowing exactly that the partner next to you is trying to do the same. So as for the Pan American Health Organization, we acknowledge the government of the United States, whom through the Office of the Agency for International Development and the Presidential Malaria Initiative has significantly put their trust and their finances in our organization for the last 15 years to make sure we advance the efforts to eliminate malaria in our region.
Thank you so much. Dr. Sudhadeep, I'm afraid you're my next victim. Again, Senegal dramatically changed the course of the fight against malaria by using a data-driven approach, and the Greater Mekong subregion made progress by installing some really strong surveillance systems. Can you explain to us why data and surveillance systems are so important in the fight against malaria?
Yes, surveillance system is very important for malaria eliminations. Actually, it is backbones of any malaria elimination programs. Being certified as malaria-free will require us to provide evidence that all cases are being identified and recorded in the surveillance systems. In Thailand itself, we developed a case-based surveillance systems for all malaria data and use 137 approaches to notify the case within 1 day and investigate case within 3 days and provide appropriate response within 7 days. We also install web-based analytics and interactive dashboard so that all levels of malaria officer can easily view and interpret trends and then take quick informed actions in the fields that we use. And also our partnerships with USAID and RTI Internationals currently had helped us to emphasize on not only surveillance systems, but also we call strategic information to help discuss surveillance results, inform next steps, and advocate for evidence-based policy change in the programs itself. Data also enable us to more effectively target area which malaria as we approach malaria eliminations in Thailand, our data needs have changed, and we also track the results at the sub-village levels in Thailand, where we have currently about 500 active foci this year. So our surveillance system has adapted to these new needs, and we are currently working on a new analysis to better understand why some foci show persistent transmissions. So we can start to address this challenge in the futures. And also our surveillance data is also helping us to build a risk stratification model for prevention of re-establishment of malaria planning. And once we reach zero malaria in the futures, we can maintain it malaria-free in the future. So malaria surveillance not only for eliminate malaria, so in the futures we will use that as the tool to prevent re-establishment of malaria in the future. Yeah.
Thank you so much. I wanted to go to some of the questions we've gotten from the audience. We've gotten some very, very thoughtful questions. Shannon Kelman asks, what lessons can we learn from vertical programs, so sort of malaria-focused programs, that we can apply to horizontal health programs? So building out health systems more generally, working on pandemic preparedness. Ambassador Okara, maybe we could start with you for that one. What can we learn from our experience and successes in tackling malaria in terms of improving health systems more generally?
Thank you, Dylan. And I think when I talked about the COVID situation, I did refer to it briefly. But what we've seen in investing in malaria, in terms of capacity of the health workers, the capacity of the facilities we have, the focus we have on all the private sector coming on board, itself provides useful lessons that make health security across the board quite more effective. And therefore, what we've learned in terms of the efforts that have been made so far in fighting malaria have proven very useful. For instance, I think I read the report from, was it Thailand, where some of the health workers on the ground that were previously supplying the nets and were also now being used to take thermometer temperatures and so on to assist in the pandemic. And so some of the work that they've been learning has proved very useful in the war on against the pandemic and across the board. If you look at our work on TB, on AIDS, and so on, it's the same workers that we're using to do that. So there's a patch of lessons that we've learned in harmonizing this, and I think it's useful, an effort. Countries need to understand that we're not isolating malaria and focusing on it, but if you do that, then it goes across. Dylan, I think that's what I'd like to say for now.
Wonderful, thank you so much. Another question we got from the audience is, how do you fight a disease like malaria in a region with open borders? How do countries work together towards malaria elimination? So I imagine perhaps the most famous open border zone is Shenzhen, and most of the EU is not malarial at this moment. But I know Central America, El Salvador, Honduras, Guatemala, and Nicaragua have a sort of similar free movement zone. Dr. Castellanos, could you talk a bit about how that's affected work in Central America and sort of what border controls do and don't affect in the malaria effort?
We have a combination of coordinated efforts in that sense. First, let me tell you that I personally tend to believe that malaria is not an issue of the border by itself. Malaria is an issue of the whole country, and you have multiple examples of that. I understand that the border is the political division between two nations, and that's the point where people coincide and exchange. But the malaria problem itself is not born right there. it's embedded in the structure in the inner lands of the country. So you get to see the final results of people trying to come across these borders, but this malaria has been imported from somewhere else to that border. So we concentrate in two aspects. Make sure countries are aware of which borders have that huge challenge that, again, I mentioned the great success of El Salvador, keeping great surveillance, control, diagnosis, detection, follow-up at borders with Guatemala, Honduras, and Nicaragua, and they did achieve elimination. We have similar problems between the Dominican Republic and Haiti, for instance. But we do know that the malaria problem does not limit to that geographic environment. It actually expands to the rest of the country. So as we do efforts to have access to diagnosis and treatment and surveillance at the border regions, we do greater efforts to keep countries aware that they do have to do their best to control malaria in the entire territory. Remember, Dylan, that for WHO, certification of elimination means 0 malaria cases, including asymptomatic cases in the country. So that requires a great deal of effort to find the very last case. So we do concentrate our efforts in helping countries deal with these issues at border levels, but we stress the importance of keeping up organized healthcare systems at primary healthcare level, including voluntary and community collaborators, to make sure access to diagnosis and treatment is general in the country.
Wonderful, thank you so much. We're nearing the end of our hour, so I wanted to ask a question to everyone on the panel, and so that each of you had an opportunity to address it. And that question is simply, what do you want decision makers in the US and also in your country, or the country you work in most, to know about the global fight to end malaria? So we can start with Ambassador Okara and then go down the line.
Thank you, Dylan. Now, as far as we're concerned, from our perspective, the US has offered very important leadership on the war on malaria and across the board on the global level. If you look at the investments that we've made through the Presidential Malaria Initiative, the support, the Global Fund and AIDS, TB, and malaria, these programs have been very critical in getting to the point now that we can say we are at a turning point and that we need to invest more to achieve our goal to end malaria. So we are really, really grateful to the role that America has played, and we can only encourage that America continues to do that. In fact, we think this has been perhaps its most successful and positive foreign policy contributions over a long period of time. We are quite excited about it. Now, sorry, excuse me. When we look at the current US global movement on the war on terror, there's currently a withdrawal from Afghanistan, which for us signals perhaps there will be renewed interest in other regions. And what comes to mind for us is perhaps areas like Somalia and Nigeria. Our concern would be that even as we focus on that war on terror, that we then do not disrupt the efforts we're making in those regions, that as far as malaria distribution and access is concerned, so that the war should incorporate a component on the war on malaria, so that we do not have that disruption. We like them to have that on board. We also feel that the US-China relations, especially on trade, have an impact on how we conduct access to important materials and facilities. So the more harmonious it is, the more workable it is, the better it is for us in our war on malaria, especially in Africa. President Biden has made pandemic preparedness and response a priority for the administration, focused on restarting global surveillance programs. This we think is the right policy direction, to enhance global health security, and a disease threat anywhere is a disease threat everywhere. So it's something we welcome from our end. A key priority of US investment in global development is the advancement of human rights, especially at risk or marginalized populations. Now, malaria has had that disproportionate effect on low-income and rural communities, as well as on women and children. If these populations are going to be a priority of US foreign policy, then ending malaria is a must. And I think that's the message we'd like to leave with you. While specific long-term impacts of climate change are not fully known, several effects are quite likely, and the regions that are likely to experience increased rainfall and higher average temperatures, we're likely to see a large number of internally and internationally displaced persons. And again, this will have an effect on the stability and sustainability of some of the initiatives that we are trying to pursue. And it also risks putting more people exposed to malaria. So these are just the quick points that we'd like you to take away with from this as some of the things that we'd like the authorities to take on board. Thank you very much.
Thank you so much, Ambassador. We have 1 minute left, so I'll ask our last two panelists to be brief. But Dr. Sudatheep, what do you want policymakers in the U.S. and in Thailand to know about the global fight to end malaria?
That's the good questions that I would like to raise for the decision maker in US. Actually, the global fight to end malaria has been very successful in Greater Mekong sub-regions, actually, which currently the malaria case had reduced by 97% between 2000 and 2020. So in 10 years, case reduced by 97% from the great support from US, actually. So as in Thailand, we are near eliminations. This year, we have about 2,500 cases. Thailand itself must maintain sufficient technical and financial supports from other donors, such as the US. And also, malaria elimination is in sight, but will require sustained efforts to reach zero malaria and also prevent reintroductions, so that we will reach goal to eliminate malaria by 2026. Yes. Thank you.
Thank you. And I'll give you the last word, Dr. Castellanos. What do you want American policymakers or US policymakers and policymakers in the region where you work to know about the global fight?
Well, first, I'd like to again acknowledge their great contribution. I think it's been exemplary, and I encourage governments of other countries around the world to keep up and see what has been the historical commitment of the US government, a country that does not hold malaria in its own territory, to do this outstanding effort to help countries fight this battle. The number two is that I'm positive they've been aware over the years that it's a battle that cannot be fought by themselves, and that's why they have partnered with multiple agencies and institutions all over the world. So I think it's important for us to make sure that at this level, partnership, coordination, and collaboration remains at the highest level.
Wonderful. Thank you all so much for being part of this event and this effort. Thank you. This has been a great discussion. Thank you to our panelists, Ambassador Anthony Okara from the African Leaders Malaria Alliance, Dr. Luis Gerardo Castellanos from Pan American Health Organization, and Dr. Prayuth Sudatheep from the Thailand Ministry of Public Health. And thank you again to Dr. Raj Punjabi of the President's Malaria Initiative and Olivia Ngu, who joined us earlier. Thank you all for watching, and have a lovely day.
Thank you.
Thank you, Dylan.
Thank you, Dylan.
Bye-bye.